poverty strategy?
First Minister.
Presiding Officer, any measure taken by the United Kingdom Government that helps us in our work to eradicate child poverty is welcome. The decision to lift the two-child limit that was proposed and pressed for by this Government is welcome, but the UK Government strategy still fails to recognise the damaging impact of benefit cap or the local housing allowance freeze, which only further drive families into poverty. We will continue to engage with the UK Government on these questions, and of course we will be setting out to Parliament in March the next Tackling Child Poverty Delivery Plan, which is our statutory responsibility to do so.
Marie McNair.
I thank the First Minister for that answer. Thousands of children are in poverty under Labour because they've kept Tory austerity. They bungled the scrapping of the two-child policy by keeping the benefit cap. So many families with more than 2 children may still be capped. The child poverty strategy was an opportunity for the UK Government to deliver real change, but it's fallen short of the bold action needed. In fact, the United Kingdom House of Commons Library found that if Labour had matched key SNP government policies, they could lift an additional 1.1 million children out of poverty across the UK. While Starmer struggles to get a grip on the ever-growing poverty levels across the UK, what assurances can the First Minister provide to the people of Scotland that the SNP Scottish Government will do everything it can to reduce child poverty here even further?
First Minister.
Presiding Officer, the action this Government is taking is making a real difference, and the focus, I can assure Marie McNair that the Government's focus in Scotland will remain absolutely on eradicating child poverty, and it's a central issue for discussion in the Government's budget. The decision of the UK Government to scrap the two-child limit comes after sustained and concerted pressure from the Scottish Government and charities, and it's welcome. But of course there are other measures needed, and the Government in Scotland will be taking those steps in relation to the budget. I committed that should the UK Government remove the two-child limit, the resources that this Government was going to spend on that would be allocated for other anti-child poverty measures, and I reaffirm that commitment to Parliament today.
Thank you. Question number 5, Miles Briggs.
Thank you, Presiding Officer. To ask the First Minister what assessment the Scottish Government has made of and the support it is providing to childhood dementia awareness.
First Minister.
I thank Childhood Dementia Scotland, a collaborative partnership of experts and organisations set up by Alzheimer's Scotland, for their work to raise awareness of the issues associated with childhood dementia through their new report. There is clearly more work to be done to understand the causes and the impact of childhood dementia, but what we do know is this is caused by a number of rare genetic conditions. That is why we are collaborating with NHS Education for Scotland and NHS Inform through the Rare Disease Action Plan to improve awareness and understanding of rare conditions among healthcare professionals and the public, and we will of course carefully consider the recommendations set out by Childhood Dementia Scotland.
Miles Briggs.
I thank the First Minister for that answer. At lunchtime, I'll be hosting a roundtable in Parliament alongside Alzheimer's Scotland to discuss the report's findings, which was published yesterday. Most people will not know that or be aware of these rare genetic conditions that affect almost 400 children here in Scotland and cause symptoms of dementia. The report's provided some really important evidence on prevalence and gaps in support and the impact this is having on families across our country. Despite the courage, though, and resilience of families living with childhood dementia, too many families feel isolated and having to fight for the support that they need, as childhood dementia just doesn't fit into many of the current pathways. So can I ask the First Minister if he and the Health Secretary will agree to meet with myself and campaigners, and for the Government to really consider the key recommendations in the report around childhood dementia being placed in the National Dementia Strategy, as well as developing national standards and better research in Scotland as well?
First Minister.
I'm grateful to Miles Briggs for highlighting this issue and for the important research work that is being carried out, and I welcome the fact that he will be meeting with campaigners and experts on this subject today. I would of course be happy to meet with him and representatives of the organisations with the Health Secretary to look at these questions. Mr Briggs essentially makes an argument which I accept entirely, which is the way through this is not to try to fit individuals into services, but to make sure services meet the needs of individuals. And in this case, vulnerable children with acute health requirements. It's what I would call person-centred care, and it has to be at the heart of our health service. And if we embark on our discussions considering how best we can deliver that proposition, then I think we can make progress. But I'm very happy to take forward those discussions.
Carol Mockin.
Thank you, Presiding Officer. Can I thank the First Minister for his words on this matter? In Scotland, there is no framework, consistent referral pathway or single approach to the care of children with dementia. Sadly, 50% of children with dementia die by the age of 10. So does the Scottish Government recognise this as an urgent issue, and would it provide an official response to the Dementia Scotland's recently published report on childhood dementia?
First Minister.
Yes, we will provide that response, and I think the answer that I gave to Miles Briggs will be how I will advise the Government to respond, that it should be in the frame of pursuing person-centred care, because Carol Mochan made the point that, sadly, for many of the children who are affected, their life expectancy is relatively short. So maximising their life expectancy so that every precious moment is available for their families to be with them is so absolutely vital. So I will ensure these issues are reflected in the Government's response to the research work that's been carried out.
Question number 6, Jackie Baillie.
To ask the First Minister what the Scottish Government's response is to the independent investigation into NHS Scotland by the retired consultant surgeon and former President of the Royal College of Physicians and Surgeons of Glasgow, Mr Mike McCurdy.
First Minister.
So the Government carefully considers all reports on the performance of the National Health Service.
Jackie Baillie.
Presiding Officer, Mike McCurdy's comprehensive report does lay bare the consequences of the lack of delivery in our NHS after almost 2 decades of SNP spin. And despite what the First Minister says, very little has improved under the SNP. Let's take the longest waits. The former First Minister, Humza Yousaf, said he would end waits of over 2 years by September 2022. 3 years on, and thousands of people are still waiting. Now, the First Minister is promising to end all waits over a year in just 4 months' time. But last month, we learned that 11,246 people are still waiting over 2 years. So let me ask the First Minister, who should the public trust? The SNP, who overpromise and always underdeliver, or Mike McCurdy, respected consultant, who says that more of the same will not be enough? Isn't that why Scots cannot afford another 5 years of his failing SNP government?
First Minister.
So before I come on to the substance of Jackie Baillie's question, one of the issues that will affect the performance of the National Health Service is the upsurge in conditions that put incredible pressure on the National Health Service. So today we have had from the Medical Director of NHS England the statement, and I shall read it, from the NHS National Medical Director, Professor Panda of NHS in England. This unprecedented wave of superflu is leaving the NHS facing a worst-case scenario for this time of year. Now, I'm simply saying that the health service will undoubtedly face enormous pressures and waves of cases that will come our way, which is exactly what is happening in relation to performance on accident and emergency because of flu pressures. If it's happening in England, it's likely to be happening in Scotland, and it is happening in Scotland. Now, Mr McCurdy on Monday said that his strongest advice to the health service, to the Scottish Government, should be a relentless focus on delivery. And I want to reassure Jackie Baillie that's exactly what's here just now. That is what is going on, which is why over the period since April, new outpatient waits over a year reduced by 17.9%. In the same period, the waiting list size for new inpatient and day care procedures over 52 weeks has reduced by 26.1%. It's why the number of GPs are increasing, because this government is relentlessly focused on delivery. So there's nothing for Jackie Baillie to worry about, because as we saw from the Because, as we saw from the opinion poll yesterday, nobody trusts the Labour Party on the NHS, but more people trust me and the SNP on the National Health Service.
Emma Harper.
First Minister, the evidence is clear that Scotland's NHS is turning a corner with downward trends across nearly all waiting list indicators. To suggest otherwise does a huge disservice to our fantastic NHS staff, and I suggest that Jackie Baillie and her colleagues think twice of the impact of their scaremongering of our health and social care system in Scotland and how that is having an effect on the wider population, and also perhaps reflects on their own colleagues in Wales and England's own dismal records before coming to ours.
Let's hear Ms Harper's question.
Can the First Minister advise how the SNP Scottish Government is working to deliver our NHS health service in Scotland to continue to drive down waiting times and invest in a well-funded, well-supported NHS for those who need it?
First Minister.
Well, President Officer, the first thing we do in relation to that point is that we put in place the record financial settlements for the National Health Service, which the Labour Party couldn't bring themselves to vote for in the first place. What we also do is that we put the investment in to make sure we increase GP numbers. We put in the investment to make sure that operations performed at levels we haven't seen since January 2020 before the pandemic. We see an increase in the number of diagnostic tests performed, and of course, as I've just repeated to Jackie Baillie, long waits over a year are down and down for 5 months in a row. So what this government is doing is focusing on the people's priorities. We're tackling the issues in the National Health Service, and we're delivering for the people of Scotland.
Thank you. We move to constituency and general supplementaries, and I call Tess White.
Presiding Officer, and this can't be blamed on the superflu. Aberdeen's new maternity hospital is facing further delays, more than a decade after it was first given the go-ahead. The Baird Family Hospital was originally planned to open in 2020, but more setbacks have meant it may not be finished until 2027 at the earliest. That's 7 years late. And millions of taxpayer money has been spent on rectifying design flaws. Local women are paying the price for this incompetence, while staff are struggling to cope with rising waiting times for maternity services, gynaecology, breast screening and breast surgery. First Minister, will you engage with NHS Grampian and visit the site to see for yourself the problems causing these delays?
Always through the chair. First Minister.
Officer, I understand the significance of the points that Tess White raises. Obviously, the safety of NHS facilities is absolutely essential, and in the design phase of the Baird has taken place when we have encountered issues about, which have been raised and are the subject of inquiry about hospital constructions that have been completed in other parts of Scotland. So we have to be mindful of the safety issues, which explains a lot of the issues that are at play here. The Health Secretary engages in detail with NHS Grampian to press for the earliest possible progress, because I totally accept the importance of these services being available for Tess White's constituents, and I assure her of that relentless focus on these issues, but we have to be mindful of the safety considerations that must be applied in all cases.
Thank you. Christine Graham.
Thank you very much, Presiding Officer. The First Minister will be aware of the significant financial pressures in the voluntary sector with inflationary energy, food costs and, of course, that increased national insurance. It is such that the Scottish Society for Protection of Cruelty to Animals is having to look for voluntary redundancies. In fact, that increase in national insurance is costing alone an extra $400,000 a year. Does the First Minister share my concern that the SSPCA will have to cut its services at the very time post the festive season when there will be an upsurge in demand as unwanted pets given as Christmas presents as a novelty, and when that novelty wears off, they are rejected or simply abandoned? And I declare an interest as convener of the cross-party group on animal welfare.
First Minister.
Christine Graham raises a serious issue, and we are all concerned about the sustainability of the third sector because of the additional costs they are having to meet due to the increase in employee national insurance contributions, which has been a very significant factor for all sectors to deal with, but very significant for the voluntary sector. I'm very happy for the Government to cooperate with the SSPCA in any way that we can to ensure that their important advisory and support services are available at all times during the year.
Daniel Johnson.
The First Minister will be aware that over recent months, the University of Edinburgh has been embarking on cost-cutting measures, including 350 voluntary redundancies, salary freezes and reduction in hours. Constituents of mine have brought forward a communication circulated by university where it's outlining the possibility of compulsory redundancies. The UC estimate that this could result in 1 in 8 jobs being lost. But it's not just Edinburgh University. Yesterday, Strathclyde University announced plans for 70 job cuts. So does the First Minister accept that this is the result of long-term underfunding of Scottish universities by the Scottish Government? But more importantly, what does the First Minister say to university workers that will be contemplating a Christmas where they don't know if they'll have a job in the new year?
First Minister.
I think the issues are complex in the university sector because the stance of the UK Government, for example, about migration does not help the university sector. It does not help in relation to the attraction of international students, which is one of the very significant factors that's affected the resources of the university community. I, of course, accept that the Government publicly funds a proportion of university income, and these issues will, of course, be the subject of debate in the budget. But, of course, in the budget last year, Mr Johnson never supported the budget. So the universities would have got nothing, according to Mr Johnson, because he wasn't prepared to support the budget. So I simply encourage Mr Johnson to engage with the Government, and we can all make progress in supporting the universities and supporting their employees into the bargain.
Aki Dunbar.
A new report from the CBI has shown that business investment in Scotland has risen to a 20-year high, in contrast to a fall across the UK. The success for Scotland's economy comes despite the UK Government's tax on jobs and low-growth model. Can the First Minister advise how the Scottish Government plans to build on this momentum and continue to deliver economic growth, even with the limits of devolution?
First Minister.
The report from the CBI is very welcome because it indicates that business investment in Scotland has risen to a 20-year high, in contrast to a fall across the rest of the United Kingdom. That goes alongside the fact that unemployment in Scotland is lower than the rest of the United Kingdom. The credit rating agencies, which said that Scotland had a strong and diverse economy and it benefited from prudent financial management in the public finances and institutional strength. So I think what this report demonstrates is that Scotland is an attractive place for investment, Scotland is a successful and dynamic economy, and it's got good stewardship of its public finances.
Pam Gossel.
Thank you, Presiding Officer. On Tuesday, I had a very constructive meeting with the Chief Constable, Jo Farrell. She assured me that Police Scotland are complying with the Supreme Court judgment on the definition of the word woman. The Chief Constable told me that Police Scotland did not wait on any guidance from the EHRC, but rather produced their own interim guidance, which is based on biological sex. So can I ask the First Minister again, especially bearing in mind the Sandy Peggy judgment, why has it taken almost 8 months for other public bodies to follow the law?
First Minister.
Well, I think one of the issues that we have been mindful of is the need to ensure that the complex legal judgment of the Supreme Court is correctly and properly applied in guidance. And we've taken those, we've published new guidance in a number of different areas in relation to workplaces within the Scottish Government, in relation to the guidance on schools. That has been published. So there's obvious issues that we have to continue to work through, as we saw in the judgment that was announced at the beginning of the week on Monday in relation to the Employment Tribunal, a further range of complexity that has got to be wrestled with. So I simply reassure Pam Gossel the Government is doing the work to ensure that these issues are properly addressed, and we have already done so in relation to the documents we've published.
Richard Leonard.
Thank you, Presiding Officer. I hope that the First Minister will join with me in welcoming yesterday's Supreme Court decision in the Crozier versus Scottish Power case and commend Elaine Veal, whose father, Robert Crozier, died from mesothelioma in 2018. for her unrelenting struggle in an 8-year battle with his former employer, Scottish Power plc, to win this case. So will he join me in condemning the actions of Scottish Power in resisting and obstructing this claim? And will he welcome the fact that on this occasion at least the Supreme Court has understood the clear intention of this Parliament in passing the Damages Asbestos-Related Conditions Scotland Act 2009?
First Minister.
Presiding Officer, I think Mr Leonard raises a very important example of the importance of addressing issues that are involved in the damages legislation and the enormous suffering that individuals with mesothelioma have experienced and suffered. So I associate myself very much with the comments that Mr Leonard has made, and I'm glad that this issue has been able to be resolved satisfactorily. But it should not have come to the length that it has come to ensure that that justice could be achieved.
Kevin Stewart.
Thank you, Presiding Officer. Scotland is an energy-rich country, but people are struggling with sky-high bills to heat their homes. For too many years, Westminster has squandered Scotland's energy whilst failed to provide any meaningful support to people in Scotland to raise living standards. Whilst Westminster is sitting on its hands, can the First Minister advise what steps the SNP Scottish Government is taking to support people on low incomes with their fuel bills this winter? And can he say any more about what we could do differently with the full powers over Scotland's energy with a fresh start of independence?
First Minister.
Presiding Officer, over this winter, the Government will invest over £196 million in our winter heating benefits, providing vital support towards the cost of energy for those with a greater need for heat, including low-income households, families with disabled children and young people and pensioners. In addition to this, low-income Scots, including pensioners, will continue to receive our winter heating payments worth £59.75 this winter. These payments are only available in Scotland. So those are some of the measures the Government is taking within its existing powers. Of course, people in Scotland are attracted by the very clear argument that with the enormous energy potential of our country, it is vital that that energy potential benefits the people of Scotland. So with all of the generation capability that we have, it is absurd that we have such high levels of fuel poverty, and it's only the fresh start of independence that will address that issue.
Murdo Fraser.
Thank you, Presiding Officer. Hospitality and self-catering businesses across the country, already suffering from rising costs, are reeling this week from a rates revaluation that sees, in some cases, a threefold increase in the bills they are likely to face, which they simply cannot afford. Now, I know, and the First Minister knows, the assessors are independent of government, but ministers do set the statutory framework, the rules, the assumptions, the timetables and the methodology under which the assessors operate. So will the First Minister take urgent action to address this issue before yet more hospitality businesses have to close their doors?
First Minister.
I understand the concerns that Mr Fraser is raising with me, and as he correctly says, the assessors act independently on this question. But I am concerned by the detail that I am hearing about some of the decisions that have been arrived at, which is why the Minister for Public Finance is already engaged in considering the implications of these issues and what is driving the changes in the methodologies that are producing these results. So I assure Mr Fraser that the issue has already been addressed by the Government. It is an important issue because it will affect the sustainability of many businesses as a consequence of the proposed changes, and that is being pursued by ministers at this time.
Mercedes Vialba.
Thank you, Presiding Officer. 7 prisoners in their second month on hunger strike are now at risk of death due to their deteriorating health condition. They're part of a larger group of political prisoners being held under special terrorism conditions due to alleged association with prescribed group Palestine Action. I oppose the ban on Palestine Action. I support those who have protested against the ban, and I add my voice to the call for their immediate bail while awaiting trial. On behalf of my constituents in the North East region who care deeply about this issue, can I ask the First Minister if he will join me in opposing any curtailing of human rights, intimidation, discrimination and victimisation of those who oppose genocide?
First Minister.
Presiding Officer, on the question of human rights and the liberties of individuals, I am a very strong supporter of human rights, and I have deep anxieties about what I'm hearing about the consideration that is being given to curtailing the application and the scope of the European Convention on Human Rights within the United Kingdom. I think the obligation to observe ECHR has been one of the great developments during my lifetime, which has strengthened individual rights, and we are the better for it. So I'm concerned by the direction of travel on that question, and I assure Mercedes Villalba of my support on that question. Indeed, I'll be attending a Scottish Human Rights Commission event in Parliament this evening. In relation to the custodial decisions, obviously Mercedes Villalba will appreciate that these are decisions arrived at by the application of law within the United Kingdom, and it would be inappropriate for me as First Minister, who has to observe the rule of law, to make any comment about independent decisions arrived at by prosecutorial or judicial authorities.
Faisal Chowdhury.
Thank you, Presiding Officer. My constituent, who is on NHS waiting list, recently received correspondence from NHS Lothian informing them that if they did not confirm within 21 days whether they wanted to remain on the list, they would automatically be taken off. Whilst I understand that this policy is in line with government guidance, I'm very concerned that it may be resulting in a vulnerable patient, such as elderly and those with special educational needs, missing out on essential treatment without their consent. Will the First Minister agree to instruct ministers and officials to review this policy to ensure that vulnerable patients are not being struck off waiting list unfairly?
First Minister.
Well, any individual who requires healthcare treatment should get that healthcare treatment, and that's the simple premise of the National Health Service, and that is applied in all circumstances. Obviously, it is important that we have up-to-date information on the medical conditions of individuals to enable us to plan their treatment, and that is exactly what the National Health Service does.
And Craig Hoy.
Sorry. Thank you, Presiding Officer. SNP-run Dumfries and Galloway Council is today set to vote on the controversial £68.6 million White Sands Flood Defence Scheme, which is opposed by many residents and businesses. The Scottish Government is expected to fund 80% of this project, despite serious questions remaining about its impact and its effectiveness. Given that the Scottish Government faces a massive budget black hole, and Dumfries and Galloway Council could potentially be closing rural schools to deal with its own financial crisis, will the First Minister now withdraw his government's financial support for this project, which looks to do more harm than good for residents, for businesses and for the local economy?
First Minister.
The issue of flooding at White Sands has been a long-term issue, and there has been significant parliamentary and political pressure for there to be a scheme put in place. There have been a number of very well-designed flood prevention schemes put in place in different communities in Scotland that have provided respite for families who are affected. And I simply observe that there is some early weather information that suggests very heavy rain in the southwest of Scotland over the course of this weekend. So there are challenging circumstances out there at all times. Now, obviously, this is a scheme that is being developed. These schemes are developed locally. They are put into a wider discussion across all local authorities to determine funding priorities, and the Government allocates funding accordingly. Now, that is essentially the Government collaborating with a locally based approach to the design of these flood prevention schemes. And what Mr Hoy is asking me to do is to take that power away from local authorities and to decide it in the centre. And normally Mr Hoy rails against the Government deciding on these issues. So I do understand. I've had much correspondence over the years from people who don't like the scheme that's proposed at White Sands, but I simply say that it's important that we listen carefully to the expert advice about what's the right course of action to take on these issues.
Thank you. That concludes First Minister's questions. The next item of business is a members' business debate in the name of Daniel Johnson, and there will now be a short suspension to allow those leaving the public gallery and the chamber to do so.
Could I please ask our guests in the gallery, who are most welcome in advance for your cooperation. Thank you. The next item of business is a members' business debate on motion 19319 in the name of Daniel Johnson on welcoming the report by Royal College of Psychiatrists on support for neurodevelopmental conditions. This debate will be concluded without any questions being put, and I would ask those members who would wish to speak in the debate to please press the request to speak buttons, and I call on Daniel Johnson to open the debate. Up to 7 minutes, please.
Thank you very much, Deputy Presiding Officer. And can I thank members from across the Chamber who supported my motion to enable this debate to take place? Because I think it is important. Important for a number of different reasons. Important to discuss the recommendations in the report, but also I think important so that we can actually mark the progress we've made. Because it's just a little bit more than 8 years since I first stated in this Parliament that I have ADHD and I take medication for that. It was then in 2018 that I held, I think it was the first debate to discuss ADHD by itself in this place. And I think we have made much progress. When I reflect upon the context that we had then and one we have now, I think it's much easier to talk about ADHD. I think there's much greater understanding and acceptance of that. And indeed, I find myself attending NHS briefings and other meetings, and I'm not the only person raising it as an issue. I find colleagues across the Chamber finding equal importance and raising the issues, and that is fantastic. But I also think there's been an odd flipping of the situation, because back then, in 2017, there was a stigma. It was difficult to speak up, and the government very often found itself justifying why diagnosis and prescribing was taking place. But now we have public demand for diagnosis, for assessment, for prescribing, and the government explaining why that's not taking place, and most recently, and I think we need to talk about this this afternoon, about why diagnosis isn't required. And I think that's dangerous, and I think we need to take care, because there is a scale of the problem that we have to consider. There's 42,000 children waiting for assessment. That's a 500% increase. We have 23,000 adults waiting for assessment. That's a 2,200% increase. And unfortunately, these are numbers that we've had to rely on the Royal College of Psychiatrists to produce, because they're not numbers the Scottish Government is producing. But behind that is actually a cost, a scale, not just in the frustration and human misery that a failure to diagnose, a failure to provide support comes. There's a real economic cost. It's estimated that undiagnosed autistic spectrum disorder cost the economy £44 billion. Undiagnosed ADHD, £17 billion. When you look at the prison population, the fact that 25% of the prison population is estimated to have ADHD against 3 to 5% of the general population, there's a real cost of failure here, one that we have to address. Indeed, there isn't a single neurodevelopmental condition that isn't overrepresented in the prison population by at least threefold. That's why I think this report by the Royal College of Psychiatrists is so important, because it actually sets out a very clear plan of what we can do now, both in terms of wider policy, but also in terms of clinical action and policy to address this issue. Now, just on this point around not needing a diagnosis, there are important recommendations in here, particularly of the 10 recommendations 1, 2 and 5, about non-clinical pathways, about the way we can adjust approaches in education and indeed wider public policy that can help people with ADHD and autism. Looking at the practical, reasonable adjustments that don't need a diagnosis in order to take place. There's also points 9 and 10 about wider understanding and improving that across the general population, and those are important. But let's be very clear. The bulk of these recommendations are about clinical pathways, are about access to diagnosis. Explicitly, recommendation number 3 talks about the increase in access to medication. Increase in access to medication. That's not denying that medication is important. Because let me be very clear, and I've been clear about this in the past, medication for many people, and certainly for me, was the biggest single step that I could take to helping me with my condition. It is the thing. There are many people approach me, and they do constantly. They say that it helps them in terms of their ability to hold down a job, to maintain their relationships with their family, deal with the chaos that ADHD often brings. But it also sets out in the other recommendations in the Royal College of Psychiatrists report about the need for new guidelines, including new sign guidance. We don't have any sign guidelines for ADHD. We need new general adult psychiatric standards, and we need a 4-tiered model to accessing diagnosis and support. This is clear and it's practical. But let me also just pull out one other features. I think we need to tackle head-on primary care. And within the recommendations here, within recommendations 3 and 4, the Royal College of Psychiatrists are explicit. We need to bring forward a structure and means by which GPs can actively participate in prescribing. That we have seen changes and advances in our understandings of that condition, because I think that is critical. Because let's talk about the other elephant in the room, shared care. Because the reality is that GPs across this country have stopped doing what was once understood and received practice of entering into shared care on the basis of a private diagnosis. Now, I don't think you should have to have a private diagnosis to get the treatment you want. I don't want a system that relies upon that at all. But we need a pragmatic approach, because the reality is this. In recent months, I've had lots of conversations, and GPs will tell you that they're not allowed to do shared care anymore. That's not true. Health boards are clear that it's not them preventing that. Indeed, even the local medical committees say that what they have produced, the guidelines, aren't a prohibition. And yet we seem to have a situation where health boards, GPs, local medical committees are doing a kind of a mutual blame activity here, all pointing the finger in other directions. We need a pragmatic approach, one where we recognise that very often these private diagnoses are being undertaken by the very same people that would be undertaking NHS diagnosis. So can we have a practical approach, a standardisation as called for about what good diagnosis looks like, and so that we can actually accept diagnosis that has occurred elsewhere? Very happy to give, but have to be brief.
Declaration of interest of practicing an NHS GP. The issue is the shared care. When you have a private diagnosis, it is no longer shared care because you are no longer seeing that private consultant. So what we really need is that diagnosis being transferred into the NHS for that shared care to happen.
Daniel Johnson.
And actually, the standardised approach, I think, adopts that point. But it is shared care if you are continuing to see that private practitioner, but the GP prescribing. But we need some standardisation. I think we need pragmatism. But above all else, I think we need clarity. So what I would say to the Minister is this: let's have the numbers. Let's understand how many people are waiting. Let's have clear, standardised approaches. And let's have a plan to clear this backlog, because behind it is tens of thousands of people in crisis. Thank you very much.
Thank you, Mr Johnson. We now move to the open debate. Backbench speeches of up to 4 minutes. I call Paul McLennan to be followed by Sanjay Gohani.
Thank you, Presiding Officer. And can I thank Daniel Johnson for bringing this debate to the Chamber today. Daniel and I have had a couple of chats about this over the last couple of months. It's an issue that we're all aware of through our constituents. It's obviously multi-layered and it's multi-agency and impacts on families, children and health, obviously, and in education setting. And like many others, I've met with the RCP in Scotland just last week about the report in terms of that. And there's a few things I think that's coming through. And I think one of the key things, obviously, it does impact on many aspects of people's lives. It's major emotional, social and health impacts. The point that Daniel Johnson has made around about access to diagnosis and medication is incredibly important. An issue around about GPs, and we've discussed this at Lothian Health Board, for example, and health boards. The standardisation point is really, really important because there are different aspects from different GPs in terms of that. So Daniel's touched upon the number of people it impacts, and the NDCs impact roughly 10 to 15% of the population, and it's good now that people actually begin to talk around about this, and I think NDCs are probably significantly underdiagnosed in terms of that. We heard about the referrals and the increase in referrals alone, and I think referrals to health boards increased between 500% and 800% across health boards between 2019 and 2021. Now, that's been driven, I think, by several factors. One, society is made more aware of it. And I think there's unmet historical needs, and obviously there's population growth. And there's no denying the impact of COVID as well. The key thing, I think, for me, and this is what the RCP kind of said this as well in terms of this, weren't exactly saying the debate was around about finance, and I'll touch on that in a second. It was around about the standardisation of some of the referrals of treatment and support pathways that are there. And I'll be keen to pick up from the Minister in terms of that. And we've had, again, a quick chat with the Minister on that particular point. I think without a nationally agreed pathway, it does make this really difficult in terms of how we can see things moving forward. And pressure is only going to grow, I think, in the next number of months and years as people become more aware of it. In terms of that, it's an issue that constituents come to me on a regular basis. And again, even within East Lothian, in terms of how the GPs deal with that, is very different. So what's the future? And again, this is the key thing that the RCP report talked about. And there are some lessons. I think the National Autism Implementation Plan carried out a feasibility study for the pathway in 2021. It mentioned a few things, and we're still going to, I think, talking into that now. One was talking about the pathways. There is still a need, obviously, for pathways, and that's to replace almost like the single condition approaches, and I think that's incredibly important, and that has to be accessible over the 14 health boards. In terms of that, again, Daniel Johnson talked about the need to deliver local stepped care pathway models. Now, I interact with an organisation called Stand, who are very active in East Lothian, and this is one of their key aims that they talk around about that. And it does include the third sector and community services, and that's access to self-help, peer support, and a range of other services during and, of course, after diagnosis. So there's a key other recommendations, I think, that are keen to be taken forward. It's obviously talking about a governance framework, the need for a competency-building framework at all levels of service provision. And Daniel Johnson touched about the delivery of the 4 points. I think it's been mentioned by the RCP. One was obviously about the national public health approach, and that's about developing a public health campaign to promote awareness and understanding of the conditions, including and emphasising self-management, national self-help resources, and that's creating a centralised platform to provide comprehensive self-help. Specialist third sector commissioning for NDC, and again this has to be localised, and we've had this discussion with Lothian Health Board in terms of that as well. And Lothian Health Board themselves mention, and it's almost that blame game talking about how the GPs in terms of that, so we need to clear that up. And I think one of the key things as well is obviously around about how we prioritise investment in developing that, and this is obviously talking about the multidisciplinary approach, which include clinicians and include GPs in terms of that. So we could talk about this for much longer, but in conclusion, I just thank Daniel Johnson for bringing this forward, the debate today. It's an issue that's going to continue to be debated in here, and I look forward to hearing from the Minister, particularly in the RC report, on the debate. But thank you, President Officer.
Thank you, Mr McLennan. I call Sanish Gohani to be followed by Cara Mocking.
Thank you. The Royal College of Psychiatrists report lays out in clear and evidence-based terms what many of us have been warning for years. Demand has soared. As of March 2025, over 42,000 children and 23,000 adults were waiting for a neurodevelopmental assessment. This is not a marginal increase. Children's waits have risen by over 500%, adults by 2,200% since 2020. These numbers represent lives on hold, children becoming adults and being sent to the back of the queue again, parents in despair and adults left without clarity, without support and without hope. But let's be clear, the scale of this crisis is not simply the result of increased demand. It is also because the government for years reassured themselves that everything was fine. And it most certainly wasn't fine. And shamefully, they knew it, because they conflated data, changed the way data was collected, and then used flawed data to game the system. Now, the Royal College